glass ionomer, the traditional glass ionomer, or what we call resin modified or resin reinforced glass ionomer category. And then of course we also have the group of resin-based materials that we call the CEMs. And so, when we think about using glass ionomers, and I use a lot of glass ionomer materials in my office, it really is sort of my go-to when I do traditional cementation. And I will do traditional cementation. I do still do gold restorations in my office. I do still do PFMs. I do zirconia, and I do lithium disilicate. And I will cement all of those depending on the clinical situation. And I like glass ionomer for a lot of reasons. Glass ionomer is incredibly pulpily friendly. It is really great at sealing dental tubules, so you have a very, very low to no instance of post-op sensitivity where a tooth is going to be sensitive and a patient is going to complain about post-op sensitivity. It's really easy material to use, and so lots of different delivery systems, but most of us today are probably using a delivery system where we just put a self-mixing tip on the end of a syringe, and then the material is mixed as it goes through the curves in the tip, and we just inject it into the restoration, and we're ready to go. They do make versions of resin modified and traditional glass ionomers that you can use in a triturator, or that you can still hand mix today. So you have lots of choices on that delivery system. And really easy from a standpoint of you try the restoration in, adjust the contacts, adjust the occlusion, polish everything up, make sure everything's great. You're going to take the restoration out. You're going to dry or clean the inside of the restoration. You're going to dry and clean the tooth depending on how you want to do that, from a 2x2 to dry it all the way to flour of pumice and a little 2% chlorhexidine to scrub the prep or air abrading the prep. And then you're just going to load the glass ionomer material directly on the inside of the restoration, and then you're going to seat it. And so I will tell you, although I was a FujiCEM fan for years and years and years, I've just recently started using the Evolve, which is the newest version of the GC FujiCEM materials. And I'm actually in love with this glass ionomer material. And when they first were bringing it to the market, I kind of thought, how can you improve upon a resin modified glass ionomer? But okay, I'll give it a try. And they really have absolutely dramatically improved it. So it's got all the great fundamental things we love about glass ionomer: pulpily friendly, seals the dental tubules, no sensitivity, really low technique sensitivity, easy to use. And I will tell you that this new FujiCEM Evolve is probably the easiest to clean up cement that I've used in a really long time. And so I seat the restoration, pick up an Explorer, make sure that my margins are sealed, the restoration's in place. Then I actually pick up my light curing unit, and I do about 3 to 4 seconds per quarter of the tooth. So I do mesiobuccal line angle, distobuccal line angle, distolingual line angle, then mesiolingual line angle. And then the FujiCEM Evolve is just in this perfect gel phase. And you can literally just peel it off almost in one piece all the way around the tooth circumferentially. You can, at this point, floss if you want to. I don't, but you could. I just clean it up really well, and then I just put a cotton wool in, let the patient bite and hold it for about 3 to 4 minutes. When they're done at the end of that 3 to 4 minutes, there's really nothing to clean up. It's already been accomplished. And so then we literally just floss, make sure there's nothing left in the interproximals, and send the patient home. So it's just the cleanup phase of the new FujiCEM Evolve is just such a vast improvement over some of the prior iterations that if you've not tried it, I would highly recommend it.